The battle against COVID-19 is in our hands. Those words were uttered by President Cyril Ramaphosa when he addressed the nation recently, announcing a relaxation of some lockdown regulations. Since then, there's been a rapid rise in infections, with more people getting back to work and, of course, lockdown-weary people becoming more relaxed about interacting with each other. Government's mantra has, however, remained the same. Wear masks, practice hand hygiene, social distance, and stay at home if you can. But what is the science behind getting people to stick to life-saving behaviour? Let's pick the brain now of clinical psychologist Professor Mark Tomlinson, who is from Stellenbosch University. He is the co-director of the Institute for Life Course Health Research at the university there. Professor, thank you so much for joining us this morning. As a scientist, it also means you're a bit of a historian when it comes to these matters as well. And in a piece that you and a colleague wrote quite recently, you went back to what we could learn from how people behaved and reacted to the 1919 Spanish flu epidemic, where millions of people lost their lives. In your opinion, did we learn from that experience all that time ago, from what you're seeing unfolding right now in the heart of this pandemic?
Thanks, Marcel. Nice to be here. I think we learned a lot. One of the difficult thing, I suppose, is one of the things we learned was that changing behavior is not very easy. Anyone who's ever tried a diet knows that 95% of the time they fail. So changing behavior is not simple. And so one of the lessons from, for example, the Spanish flu was that the Spanish flu was that despite the fear, despite the millions of people who did die, actually getting people, for example, to wear masks, even in that context where we're talking about a mortality rate, a death rate much higher than we have right now, was very difficult. And so but another lesson, for example, was that actually messages, for example, around fear are not actually very effective. And so one of the concerns that we have right now, that I have right now, and I think it certainly happened in some of the messaging in Cape Town, and I've certainly seen some stories about that in Gauteng recently, pictures of mass graves being dug, for example. Those kinds of messages we know are not effective. People immediately have what we call an optimism bias. They assume, for example, that won't happen to them. And in the context of this virus, people are not stupid. People know that if you don't have an underlying condition and if you're young, your chances of dying are particularly low. And so a message around fear is not necessarily going to work, where in fact a message, if you're asking people, for example, to protect loved ones, to protect their gogo, their auntie, their mother who's got diabetes, that's much more likely to help people who know they're at low risk. And I really need to iterate this. People are not stupid. People know. People do read, and people see what's happening out there. So if we put those messages out, it's much more likely that people will then hook into what we might call the better angels of their nature and say, I might not be at massive risk here, but I'm actually doing this for other people. I'm doing this for people that I love. I'm doing this for the elderly. And I think that those are the kinds of messages that are really, really vital.
Professor, how important is it to look at who brings across that message? You put, in the piece that you've written, you and your colleague wrote, you put quite a bit of focus on the need to use the tens of thousands of community workers that we do actually have in the system, in that them being able to be the face of bringing across that messaging would be far more proactive and beneficial than sort of a mass bombing of information across platforms.
Sure, we absolutely. I mean, we have to be targeted in the messaging, and it starts at the top. One of the key things, again, the lessons we've learned, is that when there's trust from political leadership, from national down to provincial, down to district, when people trust their political leaders, they're more likely to listen. And when the messages, for example, are contradictory or seemingly irrational, people lose trust. We also know that coercion isn't effective. And so forcing people, and obviously some laws are vital and necessary, but the more you coerce people, is that the less likely they then are to cooperate. And so we need to err on the side of cooperation. I mean, a very important issue here in South Africa, as opposed to, for example, if you're in South Korea. South Korea was very effective in, if you see these outbreaks, these hotspots, as like little bushfires or that you're trying to then quickly stamp out. If you've got a very, very, very sort of efficient system of testing where you can test 10,000 people a day, you can have the result in a day, and you have then 100,000 people tracing those people who test positive. That's the South Korea model. That's not a model that's going to work, I don't believe, in South Africa or India, for example. We need to think of different models. And in South Africa, the horses bolted. Infections, as you were saying in your earlier piece, are rampant, and so a different approach is needed. So, linked to that is if you're living in Rondebosch in Cape Town or in Sandton, shielding, lockdown is one thing. If you're living in a shack with 6 other people, the idea of physical distancing takes on a whole different kind of meaning. And so, those of the countries that are not rich countries, that don't have very, very highly developed and well-resourced health systems, need to think differently. Community health workers are an important part of that. They're trusted, they're ubiquitous, but equally local leaders, faith-based leaders are equally important in that fight. And then, so one final point is I think that one of the things that we're getting wrong. One of the things is, and I think you're pointing out of Trump finally wearing a mask is apt here, is that masks are key. And when I read a report that says somebody proudly saying there's 10,000 masks have been distributed, that's fantastic, because that's better than zero, but that's not going to make a difference. What we need is 3 masks per person in the country every day. People need to be bumping into masks. It needs to become such a part of the fabric of society that if you're not wearing a mask, you're not going to be ridiculed and stigmatized, but it's just such a natural thing. And that if you get into a taxi, you put on a mask. You get out, you throw it away, because you know now there's another one waiting for you, and you pick that up. And if we don't get to a level of that, there's a lot of talk of peaks of this infection. The reality is, until there's a vaccine, this virus is likely to be with us for a very long time.
Now, Professor, if I could just come in there, because we are running out of time, unfortunately. A day doesn't seem to go by that we don't come across a video on social media, whether from overseas, a couple of more locally, where somebody's been confronted by other South Africans. They're inside a shop and they're refusing to wear a mask, and the situations become quite heated. And I always look at these videos and I think, why? Why are you this aggressive about not wanting to wear a very simple thing that could actually save yours and somebody else's life? And I thought you might be the person that would be able to answer that from a psychological point of view. Why?
Look, I mean, I've read those cases and I've seen them. I mean, and if you think we've got a problem, I mean, the US has got an even bigger problem in that regard. I mean, I suspect that it's at the core of it is fear. People actually, to some extent, are scared. And when you feel scared and you don't have a sense of agency to be able to make yourself feel safe, people often move into sort of irrational places. And somehow, I have freedom of choice. This is a free country. I can wear it or not. You cannot tell me what to do. And that's the moment where we do have to find a way to appeal to that better angel of their nature, to the way that if they wear it, it's not actually about you and I in that interaction, because the two people fighting maybe aren't particularly necessarily at risk, but actually they're people dying and they're people at risk with underlying conditions, and we need to protect them because that's a good thing.
Thank you so much. Some great insight there. Professor Mark Tomlinson joining us there live via Skype from Cape Town. He's a clinical psychologist by training and is currently the co-director of the Institute for Life Course Health Research at Stellenbosch University. If you want to find out more, he wrote a piece that first appeared in the Daily Maverick, Behavioral Science and Its Potential to Guide Our Response to COVID-19, along with his colleague, Professor Taryn Young. Really, really interesting reading there.